I guess you are a little bit tired, but there is still another round of presentations, and the objective of my presentation is really to make a transition between all these motivational speeches we have heard from our Catalan policymakers, from our international experts, and from our expert from Sweden, in which the objective was really, I hope, to motivate you to open your minds and to pose yourself lots of questions and to understand that this is a very tricky issue. There are no easy answers, and this is a process, and this is actually what I'm going to talk about. I'm going to try to motivate you between these speeches that you had this morning and what's going to happen from this afternoon until the end of this week. And I hope with my presentation I will motivate you to stay, and also if you can't stay, to motivate the colleagues from you to come for the rest of the week, because the rest of the week is really to learn as much as we can from the international learnings about it, but also between us. So it's very important that I succeed in my talk to motivate you. Montse already presented me, but I'm just going to do a very quick overview of why ACQUAS, the organization I'm representing, which is the Agency for Health Quality and Assessment of Catalonia, is so much into research impact assessment. This comes from a little bit of history, and that started more than 10 years ago, where the Ministry of Health had a very, very small, tiny call on clinical research and health services. And since we were an agency that we assessed the system, we were wondering ourselves what was the impact of this very tiny call. And that's how we started asking ourselves these questions, and we realized that there was no methods around to talk to, or experts to talk to, or anyone to interact in order to do that. So we did our little study, but then we started to find peers or people to talk to around, and then we realized that we had to go internationally. And that's how we started to look for colleagues in different countries, and we identified some interest in Canada, some interest in the UK, and then we funded altogether this International School on Research Impact Assessment, which some of you participated 5 years ago. And it was a school where, although we co-funded and we co-organized it, we learned more than we delivered as ACQUAS. But it was the beginning of a great journey and lots of learning. With this school, we have gone through, I think, 4 continents. We had delivered the school 4 or 5 times. In each continent, the school afterwards delivered locally courses for policymakers in their continent. And the impact of these courses have been fabulous, I think, in many different contexts. My dream at that time, the first school was in Barcelona, my dream was that we had a course in Catalonia. So I'm very happy that today we're starting this course this week, and I should thank our directors for this opportunity, because what we expect is lots of learning and mutual learning, and lots of starting a journey together. I should also say that in the area of health sciences, we have started an agenda on research impact assessment just because of this. And we will go through this over the week because, of course, we have been applying our learnings in biomedical research. And this is what we call the system of assessment called SARIS. Okay, so what I'm going to talk about is a little bit more about why this is important, but also what is research impact assessment, and where are we in Catalonia. I think this has been addressed before, and what we need to do, and where to start. Okay, so why it matters. I think we had a lot of motivational speeches before, but I like to present these are the motivations I've been gathering around when I go to different talks on research impact assessment, which is now quite a lot. So first, we define strategies. Who, in what university, in what institute, research institute. We are not saying that our research strategies to make a better world, to improve society, life, future, whatever. So we define strategies. We have to be accountable for this. So there is also a social contract between science and society. There is public money invested in research. And society is investing in science. Society needs, society is making a social contract with science, and science, therefore, is making a social contract with society. So public investment, it means value for money. We need to be sure that we are optimizing the way we invest in science. We have to be sure that the money we invest in science is used in the best way for our societies. We are in the area also of accountability, 21st century, who's not talking about transparency, about accountability, and also who's not talking about co-responsibility. I think Jordi Molas-Gallard mentioned this, mentioned that all stakeholders are co-responsible of the impact of research, not only researchers themselves. In another color, I put this advocacy. We need to assess the research impact because we have to advocate for research. We have to advocate for governments investing in research. We have to, when a prime minister in whatever country decides where to put the money, whether in infrastructures, in territory, or in science, is choosing. So we have to convince, we have to have arguments for science. That means advocacy. We have to have arguments to say this is a good investment in the future. And we have to be scientific in this, so we have to be able to give evidence on this, okay? Legitimacy. We are in the moments of post-truth. Who's not giving evidence about anything, anywhere, in Twitter, everywhere? So science needs legitimacy because there is menaces around science, and this is the post-truth. More. We need to improve the way science works. We will go through this later. There are criticisms about the crisis of reproducibility, the crisis of integrity, the crisis of waste, the crisis of maybe publishing exponentially. What is all this? We're publishing so much. Are we really capturing all this knowledge? So we have to understand how science works to make it work better. Evidence-based scientific policy. We need evidence to support the decision-making in science, okay? In the health ministry, we talk very often about evidence-based health policy. So the same with science, evidence-based scientific policy. Optimize research planning. What else? Science more effective in transforming a better world. Improve the value, the chain value, and improve for the better world. This all has to do implicitly with the definition of responsible research that Jordi Molas gave us before. Okay, just a few slides about what science is more and more under scrutiny, and we have to be to have arguments when we have this scrutiny. We have things like this monograph on the economies saying, well, science can also go wrong. Maybe we're not always planning the best way we could. So this is, as scientists, we have to give answers to this. And to do this, research impact assessment is powerful. There are other articles that or editorials in very important journals, like in the Lancet, Increasing Value, Reducing Waste, in which they are calling for more evidence on how to do good research and valuable research. Here is a list of them. Another example of how science is putting alarms on that maybe the research funding could be funded in better ways. This is just an article on, that was published in the Lancet, in which they analyzed a few years after the waste series on what are funding agencies doing to avoid waste, and the results were not very good. So this is just something that we were not used to be questioned about how we tailor and design science, but now we are starting to. Journals are asking us this, so we just have to be prepared for this, okay? So, what are the responses to this scrutiny, growing scrutiny on how science is being shaped? Well, first of all, there is all this call for science more accountable to society, as I said. And here we have these two reports that most of you probably know that are designing how will the next European framework look like. In both of them, research impact or mission-oriented research is fundamental. One is in the title, and the LabFab report, I think from the 12 recommendations, 8 have to do with impact. So that means that we in Catalonia, as a science system, we have to be ready for being prepared for addressing the way we tailor our research to impact. So, so these are just a few of the more general needs, philosophical needs first, and then some criticism on science of why we need to have reactions when we are scrutinized about science. Now I'm going to talk about pragmatic needs, and this I hope will address some of the responsibilities that you in the audience have. So why in the different stakeholders of our Catalan system need to be prepared for research impact assessment? Why to engage in research impact assessment? So scientific policies. First, we just heard the experiences from other countries, so that's something to learn from. But also, as I said before, we have a number of questions that are being addressed that we need to give answer. And as I said before, we need to legitimize the science and that we fund, that we shape, that we plan, that we evaluate, and that we deliver. We need to justify the investment in science, and we need to do evidence-based scientific policy. Okay? Other government policies. Other governments, as society and science, as the social contract becomes more effective, it means that other government policies, education, territory, health, etc., need to use this science. So is co-responsible of the impact of science. The other government departments are co-responsible, okay? Evidence-based health policies, education policies, etc. So could we say in one future, could we say that science in all policies? Could we say that one day science will be used in all policies? Maybe. I put 2 examples here that I saw in Twitter recently. One is Ciencia Parlamento, trying the parliament to incorporate the view of scientists. And exactly today, this morning, in the UK Parliament, there is a research impact forum in which scientists are being invited to be part in commissions, in different commissions of the Parliament. So the Parliament in the UK today was inviting these groups of scientists to be permanently in the commissions of the different decisions that are being taken in the UK Parliament, in whatever topic. Okay, funding agencies. Horizon 2020 and Horizon Europe. Horizon 2020 is already very much oriented to impact, but Horizon Europe will be more and more so. So we have to be prepared for this. We have to be prepared as a scientific community to get as much funding as possible, so as we did to present, by reporting on our impact. That means that is reorienting the way research funding agencies are being assessed. So relevance criteria with, or whatever wording we use, because you are right, the relevance may not be the potential impact or relevance is very similar. Expert panels may change a little bit. In the Department of Health, we're introducing now the view of the patient in the expert panels. Ex-post impact assessment. Program priority setting, we also talked about this, and indicators. All the pros and cons, limitations, and strengths of indicators. Universities and research centers, they have to accomplish strategic plans. We talked about it. Public funding will more and more be conditioned to demonstrate impact, so we have to be ready for this. Accountability to taxpayers and society. Scientific journals are also changing strategies. Scientific journals, especially Science, has now launched since January this year specific journals on impact narrative. So the structure of the original article that we have been used for centuries may be changing. The original article has a structure that everybody knows. So an impact narrative has a different structure. And there are very important journals that they are starting now to publish impact narratives with peer review or whatever assessment system. They are incorporating in their governing bodies of their assessment systems other missions, people that represent the missions. In the case of the British Medical Journal, you have patients. And patients, their voice is in ensuring the mission, the orientation of the research being published. And also, these journals are more and more worried about the standards of integrity, waste reduction, replicability crisis, and the associated need to reorient the research system to missions. Okay, so as a scientific community, we have to get ready for this, and we need training, and this is why we are here, to prepare for mission-oriented proposals, to elaborate to orientate our research to these missions, and to communicate to decision makers or reviewers on relevance, and start understanding how co-creation in research works. Evaluators also will need to learn, because learn to assess research impact is different than learn to assess research excellence. The adaptation of the assessment systems, and the adaptation of the strategic plans. Okay, so with this I gave a general overview. I'm sure that with each of these slides we could discuss it further, and I'm sure I forget things for each of the slides, but this is, my objective was not to be comprehensive, just to be motivational. Now, where are we in Catalonia? I think we will all agree that Catalonia had an excellent strategy in positioning ourselves in the outstanding position in excellence. We have, as we saw in the presentations from Dr. Subirada, we have very good results in excellence as a small country in an European context. But there is so far no strategy or no preparation to reach a remarkable international position in impact. So we need, in my understanding, we need awareness and understanding, and that's why we are here, and this is the lemma of the RIACAT seminar. An introduction to the concepts, the languages, and putting all together in the same page. What will be this page is something we will go through all together through this week. The page is not set before, it will be set during the week. Impact assessment. We need tools. We have to decide what is the best tool for our context. We had invited an expert from Sweden to understand that each context matters. So we cannot just say, okay, we'll do this, we'll copy this model or that model. We have to understand the context. That's why I said to Stan, please tell us more on the context than on really what, because every country is different, every context is different, and every country has different needs, different context, different history, different future, okay? So we will discuss all these things. I'll talk more about this. So what we need is training, is understanding what is the tool that best will fit us, and also take profit of the progress we have so far. And I'm quoting here the experience that, well, first I offer that is the experience from Aqua as a co-founder of the International School on Research Impact Assessment. I will tell you more about this. And Ingenio, which is very well positioned in science of science, and we have two great experts, Jordi Molas-Ballard and Ismael Raffles, that can really be enlightening us through this process. Now, so far was research impact. Now, what is research impact assessment? RIA, we'll call it, throughout this week. First of all, research impact assessment, to me, and from what I've learned throughout this journey, is not a discipline. I would rather say it's an anti-discipline, in the sense that this doesn't give closed answers. You can, at the end of today, you cannot say, so what is the, and then we will give you an answer. That's why we need so many recommendations, not solutions, recommendations on experiences. So RIA is a practice, an approach, a way to look at things, a way to understand, a way to put questions and understand all together from mutual learning and from our experiences what would be the options, not solutions. Okay, so it's complex rather than complicated. Do you know the difference between complex and complicated? Something complicated is difficult but has one solution. I will show you here. This is complicated. It has a solution. It's a manual, a guidelines, and you start, you go through it and you get the solution. Complexity gives you options. So RIA is about options. Tomorrow, later on, I will introduce you the speakers and our experts. They will explain us the pros and cons of the options, okay? So RIA is about asking very difficult questions, sometimes having no answers, but identifying the best options, okay? Now, to me, what have been the major achievements of RIA? And that's my perception. Well, for me, I would say, first of all, that the great achievements are, and this is from my knowledge, what I've read in the literature and what I've gathered around, is basically in the Anglo-Saxon countries. RIA is a huge discussion in Canada, and Eddie knows about it, in the UK, for sure, in Australia as well. And in the US, not so much, but in those three countries especially, and in Scandinavia, I wouldn't say it's an Anglo-Saxon country, but a group of countries. But anyway, RIA is widely spread as a practice. People talk about it. Some organizations have departments of impact assessment. Some funding agencies have units of impact assessment. RIA has delivered tools in nationwide tools in the UK, in Australia, in Canada, not nationwide, but in some areas, and but it's specific in Alberta, which is where I know more, but maybe Eddie will tell us more, in Qatar, in Denmark, in the private sector, etc. But also, the lessons from learning from how science works have been very useful for transforming the way institutions run the planning of science. And also, I think, has changed the way to look at policy agendas. That's my perception. Here, I present two examples because I know them a little bit, but there are others for sure. CSIRO, Commonwealth Scientific and Industrial Research Organization, has an impact agenda. They co-organized the Impact School a couple of years ago, and because of this, different people were trained, and now they have an impact unit in the organization, and they assess impact in different areas. They plan and monitor impact, they assess it, and they report on impact, but also they do something which is what they call, they embed the impact before it occurs. So by engaging the scientific community with impact, they promote that the impact accelerates. Another example I know well is National Institutes of Health Research. Sorry, I didn't say what is CSIRO I don't know if you can see it here, well, it's an organization that was founded many in the '66, and it has a huge budget. The same with the National Institutes of Health Research, which is a research system that is within the health system, the NHS of the UK. The National Institutes of Health has also a unit of impact, has systematic assessment, embedded the assessment in the process as well to promote the impact and accelerate, and has done a major assessment after 10 years of their existence, and does continuous action on impact, like the Impact Cafe, training to researchers, seminars, etc. Okay? Now, what do I think we have to do? And this is what now will make the liaison with what we do this afternoon. After having heard of this, I think what we need, and that's what we were asked from the General Director, is to start with promoting capacities in our country, training, awareness, and tools for support decision making. And this is the RIA Seminar. Okay? So now, very briefly, I'm going to introduce what is the RIA Seminar that will start this afternoon. But I want you to understand how this seminar will work, because that will also help you to understand what will be the outcome of the seminar. We will go through this slide many times, and we will also criticize this slide many times. But what I want to say is that if in a very simplistic way we see research impact, research process as starting from inputs, then the process, then the outputs, then the outcomes, and then the impacts, what we try to involve with the RIA Seminar as stakeholders is those of the system that are involved with any part of this. Not only those that work in designing how the inputs to research should be, funding agencies, those that design how much money should go here or there in research, but also those that manage the process of research, the universities and the research organizations, those that manage and design and work with the outputs, libraries, databases on output, etc., but also those that are engaged with what are the outcomes, which is the adoption of this knowledge that will lead to what is the impact. So we have invited here also those of you that are engaged with outcomes of research and the impact, the users, those that will need to use research for your policy planning, for your everyday activity. Okay, so the RIACAT, who is involved in the RIACAT, is research planners and funders, research doers, research assessment, research compilers and repositories, research dissemination, and research potential users. Okay, now, I should acknowledge this, and this for me is very important, and I think you should all be aware of this, that the materials and the materials that will be delivered in this course come from the International School and Research Impact Assessment. But it's not a copy and paste of the International School for many reasons. One is time and resources, where the International School is 4.5 days, and was, because now it's finished, but it was delivered to people from many different countries, and it was training people on assessing impact at all different levels, from individual to groups, or projects, organizations, universities, territories, countries, disciplines. In the RIACAT Seminar is an adaptation to the Catalan context of this school. Okay, so it's not the same, it's an adaptation. I should also say that the materials of the International School on Research Impact Assessment are licensed by the Creative Commons, so can be used for anyone that is willing to use it as long as you cite it, but you cannot make money out of it. We put this for the community, because we thought it was a good thing to do. But of course, so anyone can go to the web page, which is here, and take anything you want. And this is 5 schools, I believe. And as I said, we are going to do a short and adapted version. This is the reach of the International School on Research Impact Assessment, the number of the participants from these countries, where we did the international school, but also where we delivered locally adapted courses. Okay? And now here is another slide about the difference between what is RIACAT, where we will focus on assessing the impact of a country, similar to a discipline, and while in the research impact, the ISRIA course, it was more assessing at all different levels, from the group or individual, research program, organizations, universities, and country. Okay, now one more thing about where we're taking our knowledge and materials from for the course. And this is acknowledging our sources. The ISRIA statement. I'm mentioning the ISRIA statement, which is 10-point guidelines for an effective process of research impact assessment, for one reason that also Jordi and Sten mentioned earlier, and that's the motivation of their talk, which is what the ISRIA statement says is that you should not do any research impact assessment without first understanding your context and without first understanding what are the stakeholders' needs, and not without engaging the stakeholders with the assessment. These are the 3 points that underline the course. Understanding our context, understanding what are our needs in Catalonia, and engaging our stakeholders with this process. Okay? You have the statement there. But there are copies, I think, in the. By the way, you will also, when the course starts, you will get lots of materials that will support any of the learnings. Also, this statement. And also, let me just tell you one more thing, that it's the values of ISRIA, which are also the values of the RIA seminar. Values. Orient our teaching and our delivery to practitioners. We're not going to go academic or theoretical. It's going to be all about real needs of the stakeholders, of the people that will need to design altogether a tool. Transparency, openness, a neutral approach to frameworks. We'll not be selling a framework. We'll not be selling you the payback framework or that. We will all together try to understand what is the best framework, if any, that will help us design our pathway to our strategy. I can't read it from here. I hope you can read it from there. But we want to be practical. We want to deliver social value. From this course, we want to deliver a social value. We want that all of us, if we, at the end of this week, we are all in the same page, I think this is delivering social value, because we will have discussed things. Maybe we will not agree in everything, but we will create collective intelligence. Okay, now, I'm gonna now introduce you the course, the program of the course, and after lunch, we will introduce all the actors of the course, the RIACAT group, the experts, etc. And I'm saying this because I really want you to motivate you to stay this afternoon. But what I'm going to explain you now is how the course will work. So this afternoon we'll spend most of the time, well, we spent this morning addressing the question of why we do research impact assessment, although Jordi also motivated us to think of how to. But I will give you some more foundations on RIA, and we will work very extensively in the 4 A's, okay? This will be in Catalan for one reason, because we want everybody to participate and to raise any doubt that you have. And we want to be, we would like at the end of the day, if we can define our proper definition of impact, and sometimes those of you that want to use Catalan can be free to do that. at the end of the day, like every day, we'll have what we call the active learning. And these sessions will be participative, will be divided in groups. And this will be sort of not co-creation, because if there is not outcome of this active learning, it's no problem. What we want in the active learning is that the objective of the active learning is the discussion, not the outcome of the discussion. So we really want you to sit together in groups and discuss as much as you can, whether you understood what impact is, or how does this fit in my everyday life, and what I'm going to do if we have been working like this for so many years. So we really want this to be, go as deep as possible into the many different doubts that you can have. Okay? So that's going to be day 1. Day 2, we're going to work on methods, on how and who. And we'll have, later on I will make a proper presentation, but we'll have Eddie Nason from Canada, from Ontario, that will be our special guest. And he will give us first a presentation on the compare and contrast methods. And as I said before, this presentation will not give solutions, will give options about the many, many different methods we have. We don't want you to become experts on any of these methods. What we want you is to understand what are the pros and cons, the strengths and limitations of every method. So what we want is, from this audience, to be able to choose. And if you have to commission to experts the delivery of the method, you do that. But then you are able to know that you are taking the decision that you wanted to take. Okay? So Eddie Nason will tell us more about all these methods, and then we'll have 2 more sessions, one on indicators and one on impact narratives, which are 2 methods. Why those 2? Because this is, as we saw in the earlier presentations, this is what the debate is about in research impact assessment at a national level. Okay? So we will understand what are the powers and the limitations of indicators. And Eddie Nason, again, will run this session. I will also have Ismael Raffles that will explain us also about indicators and the Leiden Manifesto. And we will understand what, at a country level, what is the reach of using indicators. And finally, we will talk about impact narratives. That probably is something that is more new for many of you. Impact narratives is a little bit like what, say, an original article. It has a structure, but it's different than the original article because it starts with the impact. And in some countries have been used to assess full systems. The most known is in the UK, the REF 2014, that was done a few years ago, and it's almost 70,000 impact narratives that have been used, that were reviewed and were used to fund 20% of the funding of the universities in the UK. We didn't have anyone from REF here because this week in REF, they are having a crucial week because they are deciding the REF 2021, and they were all closed like we are here discussing this. But on Thursday, we'll have somebody to give us more insights on REF 2014 and the next REF. Okay, so impact narratives, we'll work on impact narratives with examples that we have, with real examples. You will be sitting here, you can see it, and you will be able to touch it, from UK, from Norway, and from Sweden, and maybe Australia. I can't remember if we get it or not, but anyway. So you will be able to see this, and you will be able to see whether you can imagine that using this here, and what are the pros and cons of using this. Okay? Now, after this, we'll have lunch, and then we will talk about, again, we said engaging stakeholders is very important. So we will see how we can, what are the tricky issues about engaging the different stakeholders with these methods, with implementing these methods, okay? We'll do that, And then we'll have the active learning. Always at the end of the day, we'll have the active learnings. Active learnings will be in breakout rooms, and you will work in more freedom, because in the breakout rooms, you will be able to say things as you like, okay? So this second active learning will be on purposes and stakeholders. Now, so much for what is so-called the ISRIA materials. From this on, the next 2 days, we will work on the applications to Catalonia. How can these learnings apply to Catalonia? So, day 3, applications to Catalonia, needs and options. We'll first have a panel, an international panel, with experts from Sweden. We will have Sten Soderberg again, and then we'll have an expert from Norway. We'll have an expert from the UK that I will tell about REF, and from the European Commission. And they will tell us, from a practitioner point of view, the pros and cons, the experience, the real experience from a practitioner point of view of implementing impact narratives, and from the European Commission, what do they expect from the countries in terms of impact narrative, whether this is something that will be asked to us in the near future, okay? After this panel will do a session on understanding our context. And we will do this with a method called the horizon scan, which is we will make exercises of trying to understand our context in the science landscape from different aspects: political, economic, social, technological, environmental, and legal. And then what we can control and what we cannot control, and try to imagine in the next 3 years, if we can, how our landscape will look like, because this will help us. If we have to create a tool in 3 years' time, we have to understand how how the future will look like, if we can. So it will be an exercise. Remember, we are in a course, so nothing that will be said here is going to happen. You know, we are not oracles. So, okay, but we'll do this exercise because this will help us. Having had this international panel and having had this understanding the context will help us for the second panel of the day, which is where we will have the Catalan policymakers. And we will be able to ask them questions about how they see it, how they see all the different doubts that we will have about the Swedish experience, the Norwegian experience, what the European Commission is going to ask us, the UK, can we do the REF? Is it too ambitious? But what were the problems? Why in Scandinavia they didn't use the REF? REF is great, but why? So but also understanding our context, very important, and the limits of our understanding. So this is the second panel. Okay, we'll have 3 Catalan policymakers. If anybody here wants to step and say, I want to be a policymaker in this panel, this is a course, so you can just say, okay, I want to sit in the other, I want to try and see if I can respond, because this is a course, okay? And then we'll go to the next active learning. The next and last active learning is going to be about imagining the tool, how the tool will look like, okay? I'm not going to give you more details on how this active learning will look like, okay? Now, and then there is a last day about the applications in Catalonia, which is about implementation, okay? Now, this will be only in the morning, and we will hear what tools do we have so far. We're not going to invent a tool when we already have tools, so we have to know where are we so far and what can we build upon that. We will do also a World Cafe about planning for the future. How can we organize our task force to move on in the impact agenda? And finally, we'll do a summary of the course. Okay, so with this, I should finish my presentation, because what is really the course with the presentations of the RIACAT group and our experts will come this afternoon when the course starts. Okay, this was just a general overview. So thank you very much. I think we have lunch now, and please stay this afternoon and the rest of the week.